Hello and welcome to my channel. I am Henry, a professional psychologist. I hope you will be fine. Today we will talk about what is sexsomnia, causes, symptoms, and treatment. Let's talk about our today's topic. Sexsomnia, also referred to as sleep sex, is a sleep disorder characterized by engaging in sexual behavior while sleeping. Similar to sleepwalking and sleep talking, sexsomnia is a parasomnia, which is a sleep behavior that happens when you are in a sleep state that is between sleeping and waking. When someone is experiencing sexsomnia, they engage in sexual activity, including masturbation and sex with others, during non-rapid eye movement sleep. People who have sexsomnia do not have any recollection of what they did, and there is often shame and embarrassment associated with having the disorder. Let's talk about how common is sexsomnia. Experts are not sure exactly how common sexsomnia is, but believe that it is quite rare. One study found that among a group of patients who entered a sleep clinic for treatment, a little under 8% of them were found to have sexsomnia. This study also found that sexsomnia was 3 times more common in males than in females. Other studies have found that females are more likely to engage in masturbation during sexsomnia than males. Now talk about what are the symptoms. When someone experiences a parasomnia like sexsomnia, they are not aware that they are doing the behavior. When they wake up and are told what happened, they have no recollection. Studies have found that up to 96% of people who have sexsomnia have no memory of what happened. In fact, usually once someone learns about what they did, they are both shocked and upset. Still, what happens during sexsomnia may resemble many of the sexual behaviors that people exhibit while awake. These may include masturbation, spontaneous orgasm, sexual vocalizations, sexual movements, fondling, oral sex, anal sex, attempts at intercourse. Sexsomnia is not the same thing as nocturnal emissions or the wet dreams that males experience during adolescence or adulthood. But someone who doesn't know they have sexsomnia may mistake their experience for a wet dream. When someone's partner witnesses sexsomnia, they often notice that the person experiencing it exhibits different sexual behavior than they normally do. They may become more aggressive, show less inhibition, and may not connect in the same way with their partner. 1. They may seem glassy-eyed and distant. Sometimes the behavior that happens during sexsomnia is aggressive and happens without consent. Some instances of sexsomnia result in sexual assaults. Cases of sexual assault connected to sexsomnia have gone to court, and these are challenging cases to litigate, as it's difficult to prove whether or not an assault happened as a result of sexsomnia and what the consequences of this should be. Let's talk about what causes sexsomnia. Sleep specialists are still learning what causes sexsomnia, but there are certain medical conditions and lifestyle triggers may contribute to the disorder, like this: sleep apnea, bruxism, teeth grinding, restless leg syndrome, periodic limb movements, a history of other parasomnias such as sleepwalking, sleep terrors, or sleep talking, lifestyle triggers, alcohol consumption, use of recreational drugs, lack of sleep, exhaustion, disruptions to circadian rhythms such as jet lag or shift work. How is sexsomnia treated? Most people who experience sexsomnia don't know about it right away. They usually have to have a partner or other who witnesses the behavior and describes it to them. Even then, the degree of shame and embarrassment about the disorder may make it difficult to reach out and seek help. However, it's important to remember that sexsomnia is a recognized sleep disorder, and there is nothing you did wrong if you are someone who is experiencing it. What's more, help is out there for you. A word from psychologist. Sexsomnia may be rare, but for the people who experience it, it can have strong impacts. Sexsomnia affects not just the person who experiences it, but the people they are partnered with or share a home with. It's important to understand that having sexsomnia is nothing to be ashamed of. It's a sleep disorder and a medical condition. It's also important to keep in mind that sexsomnia is treatable, and you should know that compassionate and effective care is available to you. I hope you enjoyed the video. Please like this and share it with your friends. Please subscribe to my channel. Thanks for watching. Goodbye.